I'm Dr. David Hill, and today we're going to talk about how to diagnose an oral migraine. So what is that? Well, migraine headaches are not just headaches. They really involve transformations of how electricity and signals are processed all over the brain. That means that not everything that happens with a migraine is related to head pain. In fact, some people who get migraines never get headache at all. These can be very confusing, very weird symptoms and very distressing or disturbing to patients. So let's talk about how some of those things present. Now, many people who get a migraine headache may just get an unsettled or uneasy or weird feeling that they find very difficult to describe prior to the migraine. The most common auras that we see with migraines are visual changes, and they can come in a lot of flavors. The most common are flashing lights, almost like fireworks. You can get zigzaggy lines, you can get outlines around people or objects. You can get parts of your vision that seem to come and go or that you can't see particularly well. You might even get visual distortions. Things may look too small or too far away compared to how you know they really are. It's okay, you're not going crazy, but you probably are having a migraine. Now, to be very careful about this, let me say, if all you're having is visual changes, you really want to seek a doctor's care. That may be a migraine, but you may also be having blood clots in the retina that supplies, in the artery that supplies your retina in the back of your eye. That's a very dangerous and vision-threatening condition. You may be having strokes or mini strokes. So if the only thing you're having is visual changes, for gosh sake, go see a doctor about your vision and the visual changes and make sure that this really is a migraine. Now, some people have aura that involves a sound or a smell or tingling or even nausea or abdominal pain. These may all be manifestations of migraine. And for all of those things, you really do want to go see a doctor, even perhaps a neurologist, but most primary care doctors feel comfortable managing migraines, at least simple ones, and get a full history, get a full physical exam that includes a thorough neurologic exam, looking at nerve function all over the body from the face down to the toes to make sure that you don't have something more significant going on with your brain. Now, if you do have an oral migraine, it's probably going to respond to the same medicines that headache migraines respond to. There are pain relievers, such as ibuprofen or Excedrin migraine or Tylenol. There are migraine-specific medications like Imitrex or Maxalt. And then there are medications that can prevent migraines when they occur frequently. Things like propranolol, which is sold as Inderal, amitriptyline, or topiramate. These are all things you're going to want to talk to the doctor managing your migraines about and see what's going to work out best for you. Talking about managing oral migraines, I'm Dr. David Hill.